Okay, Daniel, how are you? Hope you're well this week. Hope you have had a good week and not been too busy. We're going to start off where we finished off last time. You wasn't here for the last little bit last time. So it's a good place to start and associate our learning again. So we're still looking at this professional practice in sports massage. We've gone from the contraindications from last week onto associated conditions this week. So hopefully by the end of this session, we will introduce to different parts of sports massage, and by the end of this session, you should be able to describe conditions associated with sports massage and describe the procedures to follow when presenting conditions associated again with sports massage. Just like last week, if there's any time you're not too sure, any time you want me to go over the same thing over again, just please give me a smiley face, put your hand up in class, and then we can revisit what we just spoke about a minute ago. So hopefully you'll be able to follow this. If you have your manuals, then it'll be a great opportunity to follow your manuals. Again, it's Unit 5, and it's on page 187 is the start of that practice module. And we are looking at from pages, today it will be around pages 198, where it says associated conditions at the top of the folder. So, when we're looking at associated conditions, we need to look at, well, we spoke about last week firstly about how you go and introduce. Okay, brilliant, go and get, that's it. Sorry, Daniel, yeah, brilliant, go and get your manual. Okay, so we look at page 198, Daniel. It's associated conditions. It's the adaptation from we did last week. So we finished on roughly looking at how clients and medical practitioners, doctors, etc., try to correlate together to produce the best result for their clients. So sometimes you may have an opportunity to work with a doctor or other healthcare professionals as a unit to try to pass the information back or forth, so a sports massage therapist can aid in the recovery. We looked about how some of the contraindications we can help and how some of the contraindications are a little bit out of our depth, hence why we pass on to the medical professions. And like I said a minute ago, how it's very important to build up a good rapport, because clientele can come from one to the other, builds up a good reputation and allows you to have a great practice. Today we're going to look at the associated conditions, and the first thing to think about, especially with sports massage qualification, it enables you to go and work in certain occupations, certain sporting environments with certain sportsmen that is very fast and frenetic. So for example, again with football or rugby, you could be on the side doing pre-massage or post-massage, or even allowed to go onto the pitch at certain times. However, we haven't got the clients coming into our facility, or we're going to visit those in their facility, where we can really carry out a case study and really take our time in diagnosing really what sort of massage technique we're going to be using. In that environment where everything is cutthroat and everything is very fast paced, we have to think on our feet very quickly. So as this slide says, since a client may seek treatment prior to visiting GP, early recognition of possible medical conditions is one of the most serious responsibilities of any sports massage practitioner. So if we're there on the side of the pitch, a plane may go down, we're onto the pitch looking straight away. We have to make an instantaneous decision of what is going to be treatable by us and what we really have to refer on. So it is therefore vital that a sports massage practitioner recognises that not all symptoms that the client is showing may be that of a soft tissue condition. Yes, Daniel?
Okay, Steve. In terms of the level 3 sports massage, isn't it we're only allowed to deal with, we're not allowed to deal with injuries per se? It's just the
no,
massage.
You're not. That is, yeah, that is right. Yeah, it's just massage. But obviously, you have individuals, especially pre or post, game time, where you may have an individual who's
they won't want to massage. So they might want to massage before and after the actual event, but but obviously you wouldn't go on during if they were injured.
No, that's true. Yes, my apologies. That's true. Yeah, but like I say, you may have individuals pre or post that present something during the game. That they just continue the movement, but come to you after wanting a massage where you may have to make an instantaneous decision whether you actually carry on with a soft tissue massage or you present that to a physiotherapy or to a medical professional.
Okay.
So I think it's important to say to yourself that in that environment you really haven't got time to sit down and speak about case studies, pre and post type injuries, any medical conditions. They're coming to you straight after saying, my leg's a little bit tight, my calf's a little bit tight, can you have a little massage on it, for example? And you look at the limb and it's
kind of tightness and soreness.
Yeah, and it's the colours. It could be blue, could be very, very red, could be some lumps and bumps that have occurred that you may not have recognised before. So you really have to make the entertaining decision whether it's soft tissue in its nature or it's more serious. And then obviously pass those on to medical conditions. So yeah, you are correct. Yes, you wouldn't be gone on the pitch to go over certain massage techniques, but saying that, you could be on the side of a pitch when you're watching an amateur game of, let's say, tennis, or something in that one-on-one nature where you might have a participant that playing the sport, and they might come to you straight after. So even though you're not going to go onto the pitch per se, there are situations where sometimes you're in a situation where that may just occur naturally, and instinct might take over. So I think the important thing to remember is that when you're in that fast-paced environment where you have to make a snap decision, you need to make sure that any conditions that are problematic that you see that may be out of your technique regarding soft tissue have to be automatically passed on.
Okay.
Brilliant.
Great. Cool.
So if we go to the next slide, I think the important thing to remember regarding... Daniel, is your microphone still on? Can you possibly switch off a little bit?
Sure, you're gonna...
That's brilliant, just because it gives me feedback and it's quite hard to understand what I've said before to what I'm saying next, and etc. So, but again, we are looking at the associated conditions that occur alongside the contraindications that we highlighted last week. And like I say, from a sports massage therapist principle, is that sometimes you have to make snap decisions. You have to think on your feet very quickly, and you've got to classify whether it's a sports injury regarding soft tissue or it's not. And this could be the same principle, deep vein thrombosis. You may have individuals that come to you spontaneously out of the blue that you may not even have a chance to look at case studies and medical history, and they just say, oh, by the way, my leg's a little bit tight today, especially around my calf, and they might just be on a flight, for example, going from country to country or venue to venue. They may just be coming from a personal perspective. It could be a friend of a family, it could be a loved one. And all of a sudden, without even going into too much of a therapist. Yes, Daniel?
Sorry, Steve, just forgot to put my hand down.
That's no problem. So like I say, so sometimes you may not be in a situation where you actually do physically are able to carry out a health screening. And this is one of the problems that may occur because if you take a flight, for example, there's certain precautions now that allow for this deep vein thrombosis not to happen. And it's a very, very serious issue. If you look at the conditions of a deep vein thrombosis, it's when, excuse me, it usually occurs in the calf, and it's when the red blood cells stick to the vein walls, forming a blood clot called thrombus. If it's left untreated, it can increase in its size and eventually preventing blood flow from going back from the foot up back to the heart. If you do suspect that this is occurring, I think it's very wise to automatically pass on to a medical professional, because should a piece of this thrombosis break off, embolus, it will travel through the circulatory system via the venous return and may become lodged in the lungs, causing pulmonary distress or even stroke to the brain. So when we've got this deep vein thrombosis thing occurring in our calves, we have a lack of fresh oxygen going around the body, especially through our calves, and get a lot of waste products. And it's through this waste products that it's unable to transfer it through the body through its natural process of lifting things up through our little veins, because obviously we have gravitational pushing down, and we need a venous return system, a pumping system to pump this blood back up. But unfortunately, because it's full of toxins, it will swell in its size, causing problems. And eventually you get a lack of oxygen to the parts, and obviously the part starts to get decayed, and obviously in certain situations that part of the limb has to be taken off due to the lack of oxygen flow through it. If you then continue massaging, and if that's the case, you was doing that and you didn't realize it's deep vein thrombosis, it's just a tightness in the calf, you could, as a byproduct, break off this little bit of blood clot, and obviously you're pushing it straight into the blood system, you're pumping it up the system, and unfortunately that can, due to the pressure, lead to a stroke or some pulmonary disease. So it's important that if you do feel that there's deep vein thrombosis occurring, you automatically pass it on. And like I say, when you start massaging calves, for example, you could be post or pre-event, and someone comes to you and they say, my calf's a little bit tight. Okay, the first thing we want to do really is get into those calves and massage them. And sometimes, because it's an instantaneous thing, we may have 4 or 5 clients waiting. We really need to say to ourselves, okay, this may not be deep vein thrombosis, but a tight calf situation may occur due to the problem of deep vein thrombosis. So we really need to have that in our mind when we can carry out any instantaneous, on-the-spot type massage. If we have the chance to speak to them and get previous history, there may be an indication of deep vein thrombosis just by the way they're moving, just by their posture, and just by past illnesses or injuries that have occurred. But if we don't pick up this information quickly, we could cause more problems than we actually solve. So what is deep vein thrombosis presented? So I have a client come to me, it says, actually my calf's a little bit tight. Could it be a calf strain? Could well be. Could it be deep vein thrombosis? Yes, could well be. But what are the symptoms that's presenting to us? We could be looking at aching or cramping. We could be looking at deep pain if we start to touch it, so really deep palpation. There could be edema, a swelling around the joint, distal to the area, so we could be looking at our ankle to start to swell. And there can be increased pain when you dorsiflex and pull the foot back to you. So we could have aching, which could just be a factor of overuse injuries. We could have pain on deep palpation, and again, could be overuse injuries. But the swelling, the edema around the joint, around the ankle, is a really big indication, because we're not moving fluid around our body. It's been stagnated. Yes, unfortunately, we have to abide to gravity, so gravity is pushing down. So we have certain parts in our body, little veins, little venous systems, little pumping systems that push everything back up through the system, up to the heart, into the lungs, etc. If we have a swelling there, it's an indication that these little pumping systems are not working adequately enough, and I'm not getting enough oxygen in. If I can't get oxygen into the system, unfortunately, that's going to cause its own problems due to a lack of life, and decay starts to occur. And like I say, in due course, sometimes amputation is a byproduct. And just if you just get someone to dorsiflex their foot, there could be an increased pain just by bringing their foot up. So again, a few little indications of what may be occurring if you do have deep vein thrombosis. But we need to look at other factors as well. So again, if we are speaking to a client and we have a chance to look at a case study, there may be indications within this case study or just by words they give you about situations which may have occurred currently or in the past that's going to influence whether deep vein thrombosis may be occurring. So if it's prolonged inactivity as a bed rest, so that could be from an illness, that could be from a previous injury, could be an injury to my right leg and my left leg is being affected. If there's things like obesity, so if I'm carrying excess amount of weight, which is pressure on the circulatory system, again, my body is struggling to pump blood around the system and take away byproducts. Age, activity levels start to go down, I lose a little bit of muscle tone, and these venous return pumps inside our muscular system start to get smaller and weaker and weaker. Drugs, like contraceptive pill, previous history of deep vein thrombosis. And if we have an increased coagulation, i.e. clogging effect due to blood loss, possibly after surgery due to childbirth. So again, if we have a lot of blood that we've lost, if we've been in bed for a certain amount of time, if we've had post-injury or surgery to a part of the body, i.e. the calf, and we start to look at damage to the venal walls. We're looking at obesity, which is one of the biggest epidemics in the world at the moment, carrying too much weight, stopping circulatory system from functioning optimally. We're all going to get older, so as we get older, hopefully we're not going to reduce too much activity level, but reducing activity level, less muscle tone, less ability to pump blood around the body. And like I say, things like contraceptive pill for the females, or just previous history genetically from parents, but also previous history from deep vein thrombosis running through either the family or just from yourself through any of the above situations. So again, deep vein thrombosis, it's a problem. It will start quickly. It can cause distress and severe amount of pain and unfortunately amputation to individuals, but there are symptoms and there are signs that are showing. The problem occurs is when some of these signs are also associated just with muscle tightness, overuse syndromes. So we need to start to classify. If a person comes to you with tight calves, yes, it could be a tight calf, but we have to have this in the back of the mind thinking there could be something more serious affecting here. So if we continue the last few slides on deep vein thrombosis, we're looking at a little bit of, let's say, a pathway that if one of these two things occur, you could be pretty cemented in your ideas that you either deep vein thrombosis suspected or actually not many two problems going to occur. So after checking for deep vein thrombosis factors, the previous list, it's still unusual for the following guidelines to be used. So in your own mind, you can have this as a blueprint. Muscle aching due to indicated overuse, massage is normally suitable. So if your individual saying I'm training, you could have a good indication that overuse syndrome is happening. Muscle aching due to overuse or for no apparent reason. So my calves are just aching. Don't know why. I'm not doing a great deal of movement at the moment, but my calves really feel like aching. You could suspect some form of DVT. If in doubt, refer someone who has deep vein thrombosis, more of a serious condition, to your medical expert. So if you're not too sure, and you're not too sure if it's just overuse, or you're not too sure that it's showing symptoms of deep vein thrombosis, just refer them to a medical practitioner, i.e. your doctor, and let them carry out tests. Brilliant. So just a little bit on deep vein thrombosis. Is there anything there, Daniel, Rich, you're not too sure about? If there's anything there, Rich, I've maybe gone over too quickly, or anything there that you feel you need to have more information about? No, brilliant. Like I say, it's on the increase because we are living older and we are not moving enough, and we do fly. So if someone comes to you who's a little bit older, someone comes to you who has little inactivity, someone's come to you a bit obese, previous history, etc., and they're taking flights, obviously the pressure situation from outside to inside, so outside into the seats by the cockpit, etc., into the plane. Obviously, then pressure changes within your system can cause and bring on deep vein thrombosis quickly. So again, there's special socks, special tourniquets that you use to prevent excess pressure from occurring. So again, if someone's going to want to take an airplane journey and you suspect they have DVT, then again, as a massage therapist, you're going to have to make a decision whether what you're going to be doing is correct or what you're doing may cause some problems, not after your session, but maybe a week or 2 weeks after, because you accelerating something which is already there, and obviously when they go on to the pressure change, that's going to magnify it even more. So I think the thing to remember from these slides really is, as a massage therapist, sometimes you're going to have to think on your feet. Sometimes you're not going for all the information which you previously had if the client comes to you or you go to the client. And in this one and a few of the things after this sort of slides, we have to think about deep vein thrombosis being an associated condition that, if treated well, can be cured very, very quickly. If not, and just by enthusiasm of wanting to help the person with the tight calf situation, and we're not really thinking too quickly in our feet, whether it's pre or post, then we could be causing problems elsewhere down the line. So again, I think at all times it's taking time, thinking about the situation, asking as many questions as you possibly can, and making a good decision. And if you still feel that the decision you're going to make it's not cemented with a positive outlook, then please just refer them to somebody else, especially a medical practitioner, to allow them to treat the condition. So when we look at another condition which is associated with our contraindications before, but also associated with sports massage therapists, it's myositis ossificans. So with the myositis ossificans, we look at myo, meaning muscle. Itis means inflammation. OS means bone, and ifficans means formation. So it's the inflammation resulting from bone formation growth in the muscle. This occurs when you have a little bone chips, so you could be overuse syndrome occurs a lot through myositis ossificans, especially in the calf situation again. It's where I'm using my system, my skeletal system over and over and over again during the same patterns of movement. So for example, running. I have a particular running style. It may not be the most mechanical running style, the most efficient running style, but I have a running style and I continue using this mechanical movement over and over and over again on hard conditions like concrete, like tarmac, maybe a cambiant, so I'm on a bit of a slope, and I'm using the same movements over and over again. So my overuse syndrome is starting to get stronger and stronger and stronger. And it's where little bone chips are starting to peel off, you can say, or just start to come away from different parts of my system. So my tibia, my fibula, start to lose a little bit of the bone chips. So bone starts to come off in the bone. So very small little pieces of chips, and they start to get lodged, and they start to form in my muscle. And again, myositis ossificans is when inflammation results from a bone formation growth within the muscle due to little bone spurs coming off the bone consistently due to possibly poor movement and predominantly an overuse syndrome. Also, if you have an extrinsic bloat, excuse me, so if you have an extrinsic bloat, may be sufficient enough. So, for example, extrinsic bloat could just be that formation of my foot to the floor and the impact forces coming up from my system, or it could well be an external person coming to kick my legs. So I've both got internal and external problems here now. But extrinsic bloat may be significant to damage the periosteum, causing the osteoblast to build up in my bone building cells. These cells start to migrate result in what's called hematomia and act upon in a similar way to fibroblasts repair soft tissue. I.e., in this scenario, if the bleed occurs in a muscle, osteoblast will effectively repair at this point only. And since the osteoblast will classify any repair, so the calcium will build up and starts to get harder, inactivity, if continued, i.e. poor movement, over and over again, so that impact forces is going from my system not in the most mechanical, efficient way, or I'm continuing getting the same blow over and over again, this will result in bone formation again within that muscle. So the important thing to think of when people look at extrinsic blows, they automatically think from outside in, but we could also be going from inside out just for our poor mechanical movement. And it's when damage to the periosteum, the little skin around the bone, and it causes osteoblast. As soon as I get this periosteum deformity, so overuse syndrome again, this big periosteum deformity, I start to get osteoblast trying to repair the area. If this is repairing over again, this migrates to result in hematomia, so a blood clot, which acts upon the same way as fibroblasts repair soft tissue. If the bleeding occurs within a muscle, the osteoblast will affect the repair at this point only, causing hardness and little spurs. And since osteoblasts were classified in any repair, so the calcium build-up, taking calcium out of the bone into this repair module, if the activity still continued, it will form bone within the muscle. Again, very serious, especially when external comes in, but also more importantly, probably through just poor mechanics when you're forcing your foot through the floor and taking impact forces that unfortunately that part of the body isn't able to control. So if you do suspect someone with myositis ossificans, other than pain from impact, i.e. again putting the foot to the floor or getting hit from an external object, there are no symptoms immediately following injury. So, problem occurs now when after a period of time it starts to feel easier and easier and easier. However, as a classification, after 2 or 4 weeks, the following signs will start to occur. You reduce your range of motion, you get pain on contraction or stretch, palpation, you get hard lumps, which is the most important thing, hard lumps around the muscle of the periosteum. And if you do then go for an x-ray, it will reveal some sort of cotton wool formation distal to the bone, so a little crossing formation that looks like cotton wool. So it's very hard to suspect someone with myositis ossificans. They could just be saying, well, I've just done too much. I just don't feel good today. I've done a little bit too much training. It's a little bit tender in that area. After a couple of days, it may start to go away. However, after 2 to 4 weeks, if reduced range of motion within that part of the body is still occurring, if pain, when you start to stretch or use contraction, so let's say the calf, if I dorsiflex or plantar flex my foot, I will start to feel pain around my shin, tibia and fibula, and the back by my calf. If I put my hand, I will start to feel these hard lumps, and again, that would be associated with palpation. If I touch the hard lumps and go into a reduced range of motion or a dorsiflexion type format, if it's around by the ankle and the lower limb, then I'll feel more tenderness on that palpation. And again, if I do go for an x-ray, there will be a cotton wool type formation, very cloudy in its nature, and the formation distal, furthest away from the bone in question. Cool. Again, that's the last one within myositis ossificans. I think it's important to remember that people with poor mechanical movement tend to get a lot of shin splints, for example, and if that continues over and over again, obviously that periosteum starting to be dispersed, getting formation through our osteoblasts, and obviously our osteoblasts starting to fulfill calcium formation. And again, yes, Daniel?
So if we suspect someone that might have this, obviously we're not allowed to diagnose this, are we? So we would have to refer to the doctor or whoever. And then how's it treated? Are we allowed to massage it, or does it have to be treated by a medical professional? Yep,
I think that, especially with myositis ossificans, unfortunately there's sometimes an indication where if the problem's occurring for too long and there's excess amount of bone formation within the muscle, they will do one of two things. They will ask for continuous rest, and hopefully the formation will disperse itself naturally. But however, most times they will treat with an operation. They will just start to try to move and remove the excess bone growth within that muscle. It's only after that do you then go and get the referral back from the doctor to then go and do your treatment as a sports massage therapist. Because yes, you may be affected, but as we all know, the kinetic chain is a continuous movement of stability and mobility. So what may occur down below is definitely going to be occurred up above. What I mean by that is, if my calf's affected and my tibia and fibula affected, and I have this slight bone formation within my calf compartment, and obviously my hamstrings are going to change its position slightly, my posture is going to change, and that's going to enable my hamstrings to either actively work too much or work too little. But then the change starts to continue my quadriceps up into my hips, my lower back, etc., all the way from the left and the right side. So my whole muscular system, my whole skeletal system, and my fascial system is starting to change its position due to postural deformities. My posture will change, to allow for pain to be taken away. So I don't want to be using pain. So in this scenario, if my right leg's got a little bit of problem through my side cervicans, I'm not going to put too much pressure down below my right side. I'm going to put pressure on my left side, which is going to change my position, my pelvis, change my position, my spine slightly, and give me that muscle imbalances that occur you see in individuals. When I get these muscle imbalances and I get a firing, my nervous system starts to fire differently. I start to increase some parts, decrease some parts, and then my balance becomes a problem, my proprioceptor becomes a problem, my kinesthetic awareness becomes a problem. So I start to induce a lot of muscle imbalances and tightness in parts of the body that weren't tight before, due to the my body compensating to allow the pain to be off this side where I have this my side cervicans. So the problem may go, but then you might have to then massage different parts of the body to try to bring the posture back to an equilibrium balance point. Does that make sense, Daniel? Brilliant. So as sports massage therapist, there's a lot of work to do to bring the posture back to alignment, to allow the body to then work off both sides equally and putting force through both sides, i.e. left and right. One of the most common forms of injuries that you are going to see, you're going to see it as a personal trainer, but you're going to see it, especially as a massage therapist, is underperformance syndrome, which is easily spoken into the overtraining syndrome. Good intentions of trying to lose a little bit of weight or trying to get fitter for the summer, you tend to overtrain in your desire and wanting to achieve. You could also call it the weekend warrior syndrome. What I mean by that is you individuals who work very hard during the day, don't really have much time to exercise, and if they do, it ends up being probably a short exercise program with a little bit of intensity, and automatically the weekend comes, they've got plenty of time and they go running, or they go and play sports which they may not play for 20 years. They may not be having the same motor skills they had on those years ago. Their posture's changed and they're producing movement a little bit inefficient than they were before. So the left may be taking more pressure than the right. They may be twisting their pelvis to allow for a better shot because they haven't got a range of motion in certain parts of the body. This occurs and they start to overtrain quickly. So it could be an overtraining syndrome process of just training for long periods of time. It could also be an overtraining syndrome of training intensively where you haven't done before. So an individual may train for 5, 6, 7 hours a day, and we can definitely say that's an overtraining syndrome. They continue training way beyond their capabilities. An individual who hasn't trained at all or trained very little for time, maybe 10 minutes or 15 minutes a day, or might do an hour on the weekends, obviously they're increasing their intensity tenfold. Which is the same for someone who's trained 2 hours a day who automatically trains 3 hours a day. It's maybe not always the intensity or the time that they train, it's a starting position and how many hours are they going or intensity are they going above that. So again, we're going to see a lot of injuries with overtraining syndrome, and in hindsight, an overtraining syndrome may lead to this myositis ossificans problems, and it may then go back and lead to a deep vein thrombosis for the overuse syndrome continually occurring in certain parts of the body. So again, overuse syndrome will definitely in time migrate to other problems associated with the continued pounding and force distribution of the skeletal system. Yes, Daniel. Yeah, I think just the underperforming syndrome, just it's underperforming. I think it may be looking at an individual, maybe not just a sport individual, but all individuals that train. It may just be the fact that it's looking at you're not performing and you're not you're not performing with the same intensity as you did before. Yeah, like I say, it's a funny name, but it could just be the fact that they're not performing as strongly and not performing as well as they possibly can due to the fact that they're overtraining. Because all you remember with overtraining syndrome, not just from a physiological point of view or a biomechanical point of view in this process, but also a psychological point of view, is that we continue training and training and training, and we continue training whether it's going from very little to something or from something to even more, is that our body and our brain start to reduce the intensity that we're producing. Yes, we may continue the same motion, but the intensity's dropped. So it may be the effect of you want to get from point A to point C, and unfortunately you're going to point B well, but because you're not resting and giving your body enough time to recover, you're always going back to point A when you start again. So you never actually get to that end point, which means you're never actually performing the way your body wants to, but also the way you designed and want to yourself through a psychological profiling. So again, overuse syndrome, underperformance syndrome, for my terminology, I think underperformance means we want to perform the best we can, and we need a lot of training, we need a lot of intensity during our training, but also we need a lot of recovery during our training. The more we can recover, the greater our performance through intensity profiling. So just continue training over. Yes, Daniel?
So do we just have to have an awareness of these syndromes, because it doesn't actually affect whether we massage someone whether they've got overtraining syndrome, does it?
No, I think the thing with overtraining syndrome, I think it's going to definitely increase muscle imbalances. I think that's the thing it's going to want to do, because our body can't cope with the amount of intensity that we're doing over and over again. So there may be a problem. For example, they may say, an individual might come and say, actually my hamstring is a little bit tight, and you may actually look in and go, yeah, it's a little bit tight, and you may massage it, and they go, that feels really good, and they come back to you a week later and go, it's still tight again. And you go, okay, well, it makes no sense. Okay, let's try it again, and feel really good, and then it starts again, and you go into that process, and you're just masking, you're just taping, you're just putting like a bandage over, a first aid bandage over something which is never going to actually become efficient, because it could be that part of the body, hamstring, could be multiple, could be hamstring and one side and quadricep from the other side, and lower back and shoulder on left side and right hand, etc., because your body's going to adapt to the environment that you'll be training. So an overtraining syndrome, I'm doing the same things over and maybe over again, so obviously my muscle imbalances and my posture is changing to try to accommodate that. Unfortunately, fatigue is going to kick in quickly, and I'm going to show you signs of tightness over and over again. And I might have the greatest massage therapist in the world, and I might get off that table or standing, for example, or massage standing, and I end up going, I feel really good, I feel really great, yeah, my back feels really loose now, and I'm ready to go. And then they continue the same training they did before, and they come back to you over again. Unfortunately, from my massage perspective, like I said before, this overtraining syndrome could end up being this myositis ossificans syndrome, because they're increasing the force they're putting through their body, but they're not strong enough to control it due to fatigue. And over again, through poor mechanical, with its intrinsic, i.e. impact force to the floor, with a lack of stability, because they can't control it, because again they're fatiguing, the muscle fatiguing, become tighter and tighter and tighter, reduces our range of motion, and we may end up going this myositis ossificans syndrome. We may even go into deep vein thrombosis, because our calves being very, very contracted over and over again, and waste product can't be dispersed around the body, and again less oxygen goes in. I may then get swelling, edema down by my ankle, because I can't use that venous system to transfer the waste products away from the injured site, and again I may start increasing my chance of deep vein thrombosis. So directly no, but I think is an indirect. Any overtraining doesn't matter if it's through a biomechanical, i.e. the way you move, for a physiological, the way my internal systems are working, or psychological, the way I feel. Any other training is a problem. So when you look at the probable symptoms of overtraining, you need to look at chronic fatigue. I said that a minute ago. There's inability to recover, and they get a lot of illness. I think we've all done it, myself included. I think maybe yourself, Daniel, as well, and anybody else that's going to listen to this on the podcast or on YouTube. We've all had periods of our time and we've just trained. We found the energy from somewhere, predominantly when we're a little bit younger, but we train and we train and we train and we train and we train, and automatically there comes a point where we become ill. Start with a little cold and ends up there's been a little bit more serious. It hangs around for 2 weeks, 3 weeks, 4 weeks. Like I say, I get these aches and pains and strains that just don't seem to go. Again, it's all signs of overtraining. I could feel happy one minute, I could feel really, really mad or really, really angry or really, really sad the next. My mood states start to change because I'm not fueling my brain with enough energy. I'm not giving enough energy. My body is trying to take all the vitamins and minerals out of my system, just trying to make them recover. We all know we need a certain amount of vitamins and minerals, especially glucose, into the brain per day, per minute, to allow the brain to function. We're stripping away, we're getting tired, and my mood states can't be balanced. My hormonal system starts to be affected, my endocrine system starts to be affected, because I'm not in balance. My equilibrium is slightly off, so I start to disperse and change the way my internal system is working, just to get me to recover from what is an illness which unfortunately may have been occurring from me just carrying activities over and over again with inadequate rest. My heart rate starts to change, so my resting heart rate starts to be dispersed. I don't sleep well at night. I can't get off. My body, my brain can't synchronize that relaxation, so different parts of my nervous system are being fired at different times. When I want my body to be in a parasympathetic, a calm, effective mood, sympathetic nervous system still being activated. My heart is still racing a little bit quicker to pump blood around the body even faster to try to disperse all the waste products that's occurring due to this illness, due to my body trying to adapt due to my overtraining. Although sports massage may still be carried out, care should be taken because a lot of things are happening. There may be some infections that occur internally, and we don't want to, as a sports massage therapist, push this around the system any quicker to accelerate its progress around the body. So again, we will be careful with what we treat, because as soon as we put our hands on someone and we're trying to manipulate the muscle, we're going to manipulate the blood flow, and we're going to change that hormonal endocrine balance. And if these are fighting infection already, there's certain chemicals that have been accelerated and certain hormones that have been subdued. We don't want to start to change and open up what we're trying to naturally depress. However, if symptoms persist or worsen, the client should be medically referred. Okay, so that's the problem. If this overtraining syndrome occurs, obviously the fatigue's going to kick in, but also if they're fighting infection, they feel ill, and it's not going and it's constantly there, and their heart rate changes, the resting heart rate starts to change, and the heart rate's beating a little bit quicker, and they can't get to sleep, and they're balanced that way, then again we start to have to refer them to a medical profession. There are some medical conditions, chronic fatigue syndrome or malachic, I can't pronounce that word, but SA, the ME, I can never pronounce that word, so hopefully Daniel, you can pronounce that word yourself. But if the ME or the CFC, chronic fatigue syndrome, starts to occur, again, we have to seek some medical advice that is a lot highly trained than we are, because obviously overtraining can lead to this constant battle for your body to fight the infection. And if the overtraining syndrome has occurred for too long or been too fast and too strong, we are constantly in a state of fatigue trying to overcome. And ME and CFC has a scenario where the individual is chronically tired. The cause of that is still unknown, but one of the causes is the body's trying to fight infection over and over and over and over again. You go to, it's like being on a mountain. You go to the top of a mountain, you feel really good, you keep climbing, you hit that point, and then you just roll down the other side. And sometimes, unfortunately, there's no stopping the other side, and that's where you need medical advice and treatment straight away, because you can end up in this world of individuals who have ME and chronic fatigue, and they're fighting the constant battle of tiredness. So again, overtraining syndrome, from a sports massage therapist perspective, will change the way we psychologically, biomechanically and physically work, and if it continues over and over again, can lead to medical conditions through myositis ossificans or a deep vein thrombosis environment, or it can go from an internal environment regarding trying to fight and overcome fatigue and infection into an ME or CFC type environment, which both require, as well as myositis ossificans or deep vein thrombosis, medical conditions that require highly skilled individuals to hopefully help the individual overcome. So as a sports massage therapist, we need to understand that, yes, they're coming to me from an overtraining syndrome. Yes, it could just be muscle tightness that we could affect. Also, depending on how long the activity for overtraining occurs, we could end up going into some wells where we need to be careful of, because anything that we do may aggravate and increase the problem further by pumping this blood around the body, where we may not be the best thing to do at that particular time. Does that all make sense to you, Daniel? It's a funny word, underperformance syndrome and overtraining, but like I say, it's one of those things where we just, as an individual, need to be very aware that an individual will come to you if they're very highly sportsmanlike. Yeah, you know what it's like, Bryn. I think we've all been into a scenario where we've all just trained a little bit too much for a period of time, and unfortunately just hit the wall, so to speak. Yeah, it's definitely awareness. I think from a sports massage therapist, I think you just one of your questions you need to ask in your PARQ forms or your health questionnaire forms would be a case of how many times a week do you train, how long do you train for, how long has it been going on. And if the person's come to you going, well, I've been training for I train 5 hours a day, and it's been now going on for 12 weeks, and I do it in periods of time, you think to yourself, well, okay, what's your job? Well, I don't train. I train after work, and I sit down from 6-7 hours, and I get up and I go running, and okay, and when was the last time you? Oh, I'm constantly ill, just keeps happening. But that's okay. I just take some remedies and off I go. And I say, okay, there could be a point where you could be overtrained. And you look down, you see the calf's a little bit red, a little bit blue, see the ankles swinging a little bit, and I go, that's okay. It's just I twisted the other day and it's not right, and you've got these little lumps and bumps going on, and all of a sudden, they're not sleeping at night, and all of a sudden, you haven't participated in annual manual therapy work yet, any sports massage, but you're just speaking to them, and all of a sudden, just through indications, gives you awareness. Actually, this person could be overtraining, which could end up being a fatigue issue, or it could end up being a physical issue. So again, you start to have a little think about, okay, what is the best for this individual? Yes, a sports massage would be brilliant, but it may just be the fact that you're going to reduce your training output, and we're going to enable you to do that. So again, awareness is major key to anything you do regarding when you put some hand on the individual. Just like the contraindication, the more information you get from the individual, the better your program, but also the better your sports massage technique is going to be, and more permanent, which is the most important thing that's going to be. Okay, Daniel, I think what we do there, it's 5 to 7. We've got half hour left. I'm going to give it a 10-minute break. Chance for you to grab a drink, and definitely a chance for me to have a little drink. Okay, so I think let's have a look. So start timer. Okay, so let's say 7 minutes. I think that gives us a good 25 or so left. So I'll start then on there, and I will see you in around 25 minutes, Daniel. That's right, 7 minutes, Daniel. Hi, Daniel. So we're back again for the last half an hour, and I think we've gone through some of the major, especially the contraindication from last week, and some of the associated conditions on this week, and hopefully it's given you an insight, a little bit of maybe what you can treat as a sports massage therapist, but also if situations occur that you're not sure about, especially through medical conditions, and what might be a byproduct of certain things like overtrain use, and the indications that whether it's a fatigue type of environment or becomes a massage cervificans, a medical type of environment regarding the way the skeletal body is situated and made up, then how you're going to then pass this on to relevant professionals, and how you're going to look for little signs and symptoms to say whether you as a practitioner can use your sports massage skills or not. So hopefully it's been a little bit of education in the last couple of weeks of just making you think around situations that may already occur to you, that may occur through friends, or something sports massage therapist is giving you stories around how they have certain individuals. Okay, but if at any time you're not too sure, you have to pass them on. Because the principles behind these next set of slides, and these are the last set of slides we're going to be talking about regarding this little specific module, is the principles of best practice and legal responsibilities. Because unfortunately, if you start to treat individuals that somebody else would have referred to a medical practitioner, then you may incur some legal responsibilities regarding that situation. So always refer if you're not too sure. So regarding this, we need to explain the responsibilities of a sports massage practitioner, list the insurance requirements, explain how to access accurate information, explain the importance of valuing equality and diversity when training with clients, explain the importance of professional appearance and manner, explain the importance of continued professional development, and explain the importance of communicating to others in a professional manner. So all these next set of slides is about you as an individual. It's about how you are going to communicate with somebody else. It's about how you are going to get the best information from somebody else. It's about how you treat other people. And it's about how you ensure your practice to make sure that if something does unfortunately go wrong, is that you will not always be liable for that situation. So when we look at regulations, we need to look at things like health, safety and hygiene. Because just like any other workplace, your workplace, whether it's your office in your house or you go to a work facility, you need to have certain regulations regarding health, safety and hygiene into place. The law demands that every place of employment is a healthy, safe place to work, and only for the employees, but also for the clients that are visiting the site. So each establishment, like I say, whether it's just your own house and you have a little room on your house, you need to have health safety regulations in place, and hygiene is of the most importance. So legalizations which apply to sports massage therapists. So ideally have a look at these in your own time. Go onto Google, do a Google search, because you can look at the Health and Safety at Work Act 1974, Health and Safety First Aid Regulations of 1981, Fire Precautions 1971, Local Government Acts 1992, and Data Protection Act 1998. So somewhere within your establishment or your own private establishment, you have to have these in place before you can start to prescribe and to take on clients. So when you're setting up your clinic, you have to be responsible for the following. You have to adhere to all the relevant health and safety guidelines. These include things like equipment maintenance. So if you use certain equipment, and that could just be your massage table as a piece of equipment, manual handling, and the recording and reporting of any incidents. An interesting one there is the manual handling, because sometimes you may have an individual that comes to you that may not be able to get on your couch if you use a certain height of a couch. They may have medical conditions regarding poor posture, which stops them from getting onto the table. They may have problems associated with walking, but again, may stop them from getting on the table. And they may just be a little bit obese in situations where, again, they may not be able to position themselves on tables. So there may be a situation where you, as an individual, yes, you may manipulate the table as low as you can go, but you may have to help an individual on to your table. If you do that, please ask beforehand, do you mind me helping you get onto the table? Because touching individuals when they're not expecting it may cause yourself some problems. If something does occur, you have to report it and record it or any accident. So the best things that I used to do, and I still do at times, is carry a little dictaphone. It helps me get things down quickly. I may not have a piece of pen or paper. I may write and I may not understand my own writing, but I can speak into a dictaphone. I can get a witness statement onto a dictaphone and get the individual's record of it on a dictaphone as well. I can type that up, transcript that later on, but I have a recorded version on my dictaphone, so I A, don't forget it, but B, I can get out all the information quickly and efficiently. When you're looking at your facility as well, you need to have a high standard of hygiene. So again, everything is clean, everything is shipshape in that respect regarding the equipment safety, regarding the hygiene of yourself, regarding the hygiene of the building, the equipment, the floor, etc. You need to adhere to fire precautions, so a clearly displayed evacuation procedure is situated within your clinic and you show and highlight that to your client when they first come in. You need to be first aid cover. You need to have data handling procedures, and you need to understand implication of Supplying Goods and Service Act 1982 or the Sale of Goods Act, and how it can link with treatments or merchandise sold at the clinic. So again, you may prescribe some certain oils, or you may prescribe some certain piece of equipment that may enable the client to produce better movement after you produce your sports massage techniques. But again, you need to look at the Sale of Goods Act of 1982 to allow yourself to understand the rules and regulations of selling certain equipment at certain times. One of the most important things is recording and storing client information. So documentation must be complete within 24 hours of the treatment. The information should be written in black ink and stored in a lockable, fireproof cabinet. Lockable is one of the main key points in this sentence, because only you and your client is allowed access to any information. No third party is allowed access to that information unless the client gives that permission, and that permission will be either on a Word document signed, or a spoken document for a dictaphone, for example, or a video message to say that they allow for the information to be taken elsewhere. But only you and your client has access to information. You need to sign every single piece of paper, and no gap should be left following details of any treatment. So you sign it, you date it, you should not ever fill in anything after that. Everything should be filled in within 24 hours. If a piece of document does go wrong, do not use correction fluid. If records are stored on a computer, which most records are these days because it's easier and you can store more with less space, the information saved will be dated and timed. Any updates to the client's record form will only need to be saved under a separate file, or the data and time that the original entry was erased. An original copy of all information documents should be saved. So the best way is to save it onto files and to save it as paper so you have backup. So it's important that all the information is documented in 24 hours, kept in a safe place. Only you and your client can see that. Never fill in after you've written out your consultation forms, i.e. you've signed things, never add things to it. Missed one there, some apologies. Any advice given to a client, even in casual nature, on the phone should be recorded. So again, anytime I speak to an individual, I want to record as much information about that as I can. So again, using a dictaphone with permission of the client when you're consulting your consultation phase allows for no discrepancies between you and your client. Try to keep all the information clean and tidy, and store everything on the computer, date and timed. The records must be stored for 8 years unless the client is under 12 years of age. If that's the case, then they're stored up until the age of 25. And all information is a property of the client and cannot be, like I said before, given to a third party without consensual guidance from the client themselves. So again, it's pretty self-explanatory, but the important thing is that everything is signed, everything is locked away, everything is done within 24 hours, and only you and your client can have access to all that piece of information given. Because all that will enable you to have your insurance. So your insurance requirements that you have will all be classified around how you store information. That will be taken into consideration. Now, as an individual, you must have professional liability. So any professional that operates their own business needs professional liability and insurance to practice. You may also want to consider things like public and products liability, personal accident, income protection, critical illness, home clinic contents, travel insurance and motor home insurance. So things like personal accidents, income protection and critical illness, that's in case you have an accident yourself or you have an illness that stops you from work and that you're still entitled to earn for your insurance. So you may not be actually carrying out the sports massage techniques, but you definitely will be able to continue taking in some money from the insurance to enable you to survive for your family and your loved ones. Home and clinic contents, very important. There may be a fire, there may be some damage to your home or your clinic. Again, that will stop you from working. Travel insurance, you maybe have the opportunity to go and travel in certain situations throughout the country or throughout the world that you may need travel insurance on. Again, if things happen to you, i.e. some of your property or yourself, again, you reimburse for your insurance. And again, motor home insurance, very similar. Again, you're going to, as a mobile practitioner, you're going to be traveling from part A to part B, ideally by car at times, And again, we need to have insurance on the building or the car itself. So we need to have insurance for the contents that's inside our home or our clinic, and we also have insurance about how the vehicle that we currently use to get from position A to position B, because without a vehicle we may be stationary and we're not able to carry out our sports massage techniques. So under any professional regulations, currently there are no national regulations for sports massage practitioners. However, professional associations will have their own codes of conduct to which practitioners are required to adhere to. So things that are supportive for sports massage practitioners is membership of complementary health self-regulatory body, CNHC. These will give you governmental recommendations of proficiency and stationary professional practice. So again, have a look at the CNHC, the complementary health self-regulatory body. They will give you guidance that the government will try to endure you to. Membership of a professional association will enable advice and support on possible work opportunities with other professionals. Definitely have a look at inland revenue and tax guidance. So obviously when you start to earn money, you are liable to pay tax. Look at different websites for general information and business links for small business enterprises that enable you to associate with other individuals through practitioners or through organisations that may require a sports massage therapist. So again, building up the links with other businesses around your area can prove very successful when you're starting out into a small business. How does that sound to you, Daniel, when we're looking at things like recording and storing information, responsibility for sports massage therapists? Brilliant. Like I say, yeah, I think it's the same for any business. I think any business, whether it's a sports massage therapist or personal training or a catering business or a building firm business who's building houses, you need to have all your insurances in place that enable you to carry out your activities under national guidelines. It enables you to have insurance that enables you to claim if something unfortunately goes wrong with you through health or a building or through your car or your equipment, or your information that you've been given is stored and kept in a very, very safe place and no one else listens to that or hears that or reads that. And again, we need to look at the health and safety guidelines of how you as an individual with a certain premises adhere to fire precautions, how you adhere to first aid, because obviously an individual may require first aid, and if you're dealing with individuals in a one-to-one process, then definitely you need first aid. If you're going to sell goods, etc., etc. So any business requires these principles behind it, not just sports massage business. So when we look at the continued professional development, so we've looked at things that a business requires to be successful and by under law enable you to then trade. But when we look at continued professional development, this is us as an individual. This is me as a person who's required. I've trained as a sports massage therapist. I've gained my qualifications, but I need to continue learning and learning and learning. So we need to go through a continued professional development just on ourselves over time. So it's any learning that's undertaken by professionals to ensure that the knowledge that they've gained is updated. Because we all know that all the information that we receive in this year, 2012, there'll be more information later on in the year, there'll be more information tomorrow, there'll be more information next year. It continues. The educational system continues growing and growing and growing and growing. What was in vogue this year may not be next year. So individuals are learning and learning. More research is being done, more academical studies are being printed that enables for individuals to keep learning and putting that back into the business. So we need to continue to keep up with the times and to keep our knowledge on the pinnacle of this industry. So the importance of any CPD, continued professional development, is the various professional associations differ in their recommendation hours. So Some organisations will require you, and so they require more of the CPD time. However, each individual sports massage practitioner will need to check with the professional bodies that they're going to endorse themselves with to ensure they meet the recommended hours to gain membership or insurance for their practice. What you can do as regarding continual professional development is just keep learning and learning and learning. We can learn in the forms of workshops, training days. We can read books, we can go on the internet, we can do short courses, we can do long courses. Doesn't matter what we do, we need to record these and validate these. We need to write these down, get a witness statement to say that we've done this from a professional body, someone that's carried out the training, and continue to keep this in a log over and over again. So yes, there may be a certain amount of hours. Let's say, for example, they're 20 hours. Me personally, I will do 40 hours or 60 hours or 80 hours. I'll keep learning and keep learning, keep reading my books, keep asking questions, keep going to short courses, long courses, workshop, training days, seminars, lectures like this one that I'm presenting to you, Daniel. Again, you know, you log it into your logbook, validate it through a witness statement, record it, etc. So individuals can see where you did it, at what time you did this, and who was the individual's organisation that was presenting this. You can never have too much continued professional development. The greater your knowledge, the better your practitioner, the better your practice, the greater satisfaction to your clients. So now we've gone through our health, safety, hygiene. We need that as an individual, and we also need that as an establishment. We've gone through insurance for ourselves and our establishment. We've gone through our professional or continued professional development as an individual. That's going to enable us to have a successful practice. However, one of the most important skills that an individual can have when you're speaking on a one-to-one basis is communication skills. Because how you speak to an individual and how you present yourself to the individual will give the individual a perception and a snapshot of what they think they're going to expect through your mobilisation skills as a sports massage therapist. So if you come across a little bit shabby in your dress sense, unshaven, hair's not combed in a certain way that it usually is, you wear trainers and you wear an old suit, for example, your body language is slouched, you're turning away from them, you give yes, no answers. Even as a practitioner, the individual is going to take a snapshot and they're going to say to themselves, is this what I'm going to get from my sports massage treatment? And if it is, then maybe it's not what I want to see here right now. So before you have the chance to practice your skills, you've turned them off, so to speak, the way you've conducted your interview and your communication skills. Because remember, individual, I think it's 10 seconds, is it? Or it could be a little bit shorter than that. After that sort of time, someone's made a first impression on you, and they're going to say to themselves whether I want to be here in future or whether I want to leave very, very soon. So communication skills are an essential part of any sports massage practitioner's skill set. So again, very important to learn. Effective communication with clients will aid and gain confidence and trust, because this individual is going to be lying on your couch soon, and you're going to be putting parts of your hands on different parts of the body to aid and improve a condition they're currently having. That takes a lot of trust and a lot of belief for the person who's being touched, i.e. the client. So they need to have very much a good confidence set and very much trust within you as a practitioner to carry that activity. We need to obtain our accurate information regarding history, because we need to know as much information as we possibly can about the individual. The more information we gain, the better our skill set can be. Someone once told me, if you've asked too many questions, you probably haven't asked enough. The more questions you can ask, the easier it is to cater your skill. However, sometimes an individual will give you questions and you may have heard the same scenario before and automatically jump to the conclusion. You need to think, stop, slow down, and avoid jumping to any conclusions, because each individual is different. No individuals will be the same. That's by body, mind, and history. So there are many ways that we can communicate with an individual. We can go face to face, we can do it by phone, we can do it by letter, or we can do it by text. Obviously face to face is the best way to go, because we can see the individual's body language, we can see their expressions on their face, we can gauge a form of trust. Phone is good also. Again, I may have to use my words selectively and by the phone. Sometimes not the same situation, or maybe not getting the same reaction back because I'm not getting the eye contact. Letter, again, now we're talking about the words you write. So again, if someone's dyslexic, for example, they may find writing certain words or constructing certain sentences difficult. And then the last one we have is the text, which is very, in this day and age, is very abbreviated, and letters give you the impression of a word and can be misdrew. So face-to-face is great, phone is the next one, and then you're going down the spectrum. But depending upon the sort of information required and with whom you are dealing with, each have their own merits and disadvantages. So sometimes an individual could be a long way away and a phone is the best place to go. You could add on Skype down there because you can see the individual through the computer, or you could look at something like this Blackboard Collaborate again, where you're participating information to and from, gaining the best we can. We need to be clever with the language we use, the tone of our voice, and the physiological processes we give away. So again, how fast we speak, how much breath we take, etc. can all have significant alteration to the person's interpretation of how they see you and how they're going to see you as a practitioner within this industry. I think that may be the last one, Daniel. So hopefully by now you can explain the responsibilities of a sports massage practitioner. You can list the insurance requirements of a sports massage practitioner. You can explain how to access the information. Explain the importance of equality and diversity, treating each one the same, no matter of their past, present or future. Explain the importance of professional appearance. Explain the importance of a continuous professional development and the importance of communicating with others. Is there anything in those learning outcomes, Daniel, that we haven't covered, you feel, haven't covered enough and are not too sure about? Brilliant. That concludes our module for this professional practice. So professional practice sports massage. So we've covered the areas now. So we've got a couple more modules to go regarding this. So hopefully that you've gained everything. So yourself been here for both weeks now. Hopefully you've gained the information you require. If someone else comes onto the course next week who hasn't quite gained it, then obviously we'll go back and revisit old ground. Brilliant. Yep, the only thing is this is these worksheets. The quicker I can get these worksheets into myself, then obviously the quicker I can mark them and send them back to you, and the quicker you can get on with the course in essence. Yep, on to anatomy and physiology next week. Again, a little bit more in depth than some of the anatomy and physiology you may have done for your personal training. It's more specific to the sports massage environment. So again, hopefully your past knowledge will bring forth your views and input within this sports massage, and hopefully next week we'll be able to gain some information that maybe you don't think about regarding when you think about sports massage therapy. So hopefully that'll be a great session. So thank you very much, Daniel. Have a great week. If there's anything you need from here to now, just please give me an email and I know I'll answer it best I can. So thank you for attending, and hopefully next week more people will come and enjoy our situation. So thank you very much, Daniel.